you, relationships are critical in Washington. But how do you A, find out who the key players are, and B, figure out how to reach out to them? Well, I want to tell you about Leadership Connect. It's been an absolute lifesaver for us as we expand our operations and outreach here at WashingTECH. Leadership Connect, it's the digital service used by top federal contractors and government affairs leaders to contact decision makers and develop those strategic relationships. Visit leadershipconnect.io and join the community. I love it, and I'm 100% sure you will too. That's leadershipconnect.io. Try it now.
If we can still expect takeout, shop for wherever we want, and have it all delivered quickly with just a few clicks in this moment, why shouldn't that be the case for public support or supporting programs meant to help us with our most essential needs?
Welcome to the WashingTECH Tech Policy Podcast.
The latest tech law and policy news and brightest tech law and policy experts wherever you are.
So you can stay informed, on the move, in less time.
From Washington, D.C., it's the WashingTECH Tech Policy Podcast.
With Joe Miller.
Joe Miller.
The sharing economy all but implodes as demand for Uber, Lyft, and Airbnb plummets amidst shelter-in-place rules. Sextortionists are raking in money from unsuspecting people online, and Robert Phillips is my guest. Hey everybody, the sharing economy is all but imploding amidst sharply reduced demand for things like ride or apartment sharing as Americans shelter in place. Lyft announced that it would be laying off 17% of its workforce, with more layoffs to come. Uber's chief technology officer stepped down as the company announced that it would be laying off some 20% of its workforce, and Axios reports that Airbnb took on two separate $1 billion loans in April alone. Sextortion has been on the rise, according to a new report from cybersecurity firm Sophos. The company found that so-called sextortionists, criminals who blackmail people for thousands of dollars in exchange for not revealing their online porn habits and sexual predilections, have raked in some $500,000. Interestingly, most people didn't fall for the scheme, which involved paying into a Bitcoin wallet set up by the perpetrators. Just 0.5% of targets paid into the wallet, according to the report. Still, the amount of money these criminals raised from such a low response rate was enough to raise some red flags. Technology continues to enable hate speech and white supremacy efforts, as some investors have become unwitting funders of companies owned by white supremacists. The Tech Transparency Project found about 125 militant groups on Facebook promoting a second civil war, or boogaloo, as they refer to it. Also, SoftBank has apparently invested in surveillance firm Banjo, whose CEO, according to 1-0, apparently admitted to helping a KKK member shoot up a synagogue. According to the report, Damian Patton admitted to being involved with the Dixie Knights of the Ku Klux Klan. Pretty sobering when you think about the fact that this is a surveillance firm he's running. Banks and some consumer advocates, usually foes in their lobbying efforts, are both advocating for an exception to the general ban on robocalling Congress passed last year. The exception would allow robocalls in cases where the robocalls are designed to inform the public about financial relief. I think we can all anticipate the can of worms that would be opened here. Give banks an inch and they'll take a yard. Pam Belloc of the New York Times wrote a piece on pregnant women seeking abortions via telemedicine. A company called Teleabortion, which the FDA has approved to run during the Trump administration, serves as something of a middleman between doctors and patients by facilitating telemedicine appointments and the mailing of abortion medication. Lots of questions regarding conflicts of law issues, as each state has different abortion regulations, but you can find the story in the New York Times, and we've linked to it in the show notes. A Republican judge appointed by George W. Bush gave the green light to the city of Baltimore's aerial surveillance program, citing a highly relevant amount of violence afflicting the city. The AFL-CIO had sued the city of Baltimore back on April 9th for the spy plane program, arguing that it is an unconstitutional invasion of personal privacy and the Fourth Amendment guarantee of freedom from unreasonable government searches. More in the Baltimore Magazine. The Hill reports that Democrats in both chambers of Congress are pushing for more funding to improve broadband for people who can't access internet service that's fast enough to do things like participate in remote work or distance learning. Senators Blumenthal and Markey, as well as Congresswoman Nadia Velázquez, participated in a live stream with several advocacy organizations arguing for lower broadband prices. The 12 organizations hosting the live stream also circulated a petition containing 110,000 signatures urging guaranteed access to broadband as part of the next stimulus. Finally, Fox News has fired controversial commentators Diamond and Silk, whose real names are Lynette Hardaway and Rochelle Richardson, from their Fox Nation streaming service. The rabid Trump supporters have repeatedly promoted unsubstantiated conspiracy theories, such as the claims that the World Health Organization is able to turn the coronavirus on and off at will, that Bill Gates is hiding the vaccine as a way to control the population, and that 5G causes the coronavirus to spread. And you can find links to all of these stories in the show notes. Stay with us.
Of tech policy, WashingTECH. We see you.
My guest today is Robert Phillips, CEO of Alluma, an organization that provides people-centered, policy-driven technology solutions and consulting services to state, county, and local government agencies, nonprofits, and other partners. He leads the strategic direction, fiscal stewardship, daily operations, and overall management of the organization. A healthcare advocate and philanthropist, Robert joined the Board of Alluma, then Social Interest Solutions, in 2006 and became president of the board and CEO in 2017. Robert has been acting on his commitment to improve the health and well-being of communities in the U.S. and California for over 25 years. Please welcome Robert Phillips. Robert, welcome to the show.
Thank you for having me.
So for those who aren't aware of your great work, tell us about Alluma and its mission.
So Alluma is a nonprofit social enterprise that really has a simple mission, which is connecting folks to the help and support that they need when they need it. And we do that by really trying to integrate, two really major streams in our lives, technology and policy, to make sure that they actually work together, conspire to help folks rather than conflict and create confusion.
And these are extraordinary times. I'd put the COVID-19 era really on par with the conditions leading up to things like the Protestant Reformation, sort of this existing distrust that was there already, distrust of the power struggle, the power structure, wealth distribution, corruption. Really set the stage for new figures like Martin Luther to fill the void. Sort of like a complete restructuring, really a black swan moment like the assassination of Archduke Ferdinand, which led to World War I. And whenever we have these kinds of shifts, there's a tremendous amount of suffering, not only among the elites who are displaced, like say your Louis XVI, but especially among those who remain vulnerable despite the shifts. Either way, they're in trouble. And in the U.S., of course, we're talking about people of color, people in rural and remote areas, people living and suffering in solitude in various types of communities around the country. We're seeing some pretty stark differences in access to healthcare and even surveillance as officials treat and track this disease in a way that disproportionately disrupts and intrudes upon the lives of vulnerable populations. How are you thinking about healthcare and the role of technology sort of at the confluence of all these current events that one would suppose will ultimately be seen by historians as the preconditions that led to the changes we're going to see after we emerge from this?
For certain, the COVID crisis has made, two things very clear. One, that fixing our healthcare systems continues to be necessary. And even doing so is still wholly insufficient to us realizing how we can actually be healthy or how our communities could actually be healthy. And that is particularly true for communities that have been traditionally marginalized in this country. We're seeing a domino effect right now being driven not just by broken healthcare systems, but by broken safety systems that are meant to help us, especially when things are hard. Quite frankly, being overmatched by the basic tasks that they are created to take on. So my hope is in this dire time, it will lead us to some of the very meaningful changes that you're talking about, that there will be some structural shifts, and that the old adage of never letting a serious crisis go to waste gets exercised here, where we use it as an opportunity to do things that we thought we couldn't or wouldn't even do before. As you know well, every crisis holds an opportunity, and this crisis, as you have pointed out, is epic. It's one of the worst in our country's history. And we need to heed the things that it's exposed, particularly if we don't want to keep experiencing them in the future.
So what do you see as the main problems keeping people from getting the help they need?
Well, as you pointed out, the pandemic's laid bare the inequities that have already existed in our country, but not some of the ways that we can actually remedy them. And those problems have been thrown into sharp relief during this crisis. Institutions responsible for conveying information all have different messages with separate agendas. We're finding that families on fixed income, people in prison who by definition cannot practice social distancing, the immigrant family trying to provide for themselves and their children, the immigrant detained in an ICE jail, the farm worker who's actually still picking our crops for our tables, the homeless people we see on the street, those who are living paycheck to paycheck, those who are finding themselves without insurance because they've lost that paycheck, those in cramped housing or inadequate sanitations, all the seams, all the faults that you might think of as a seamless social economic system have really become eye-poppingly visible and showing those seams being really threadbare. And one of the things I really have to point out here is of all of the crisis that we're experiencing, one of the most heart-wrenching things of the 1 million known cases and over 55,000 deaths from COVID-19 in the US alone, the percentage of African-American, Latinx, and Native American folks is both alarming and wholly unequal. But all these problems speak to a much larger issue. It speaks to all the structural lack of access to a livable wage or the attendant lack of access to healthy neighborhoods and homes and nutritious food, the poorly resourced public agencies that we have starved over the years. All these things have conspired to leave us with fewer options to have access to the resources we all need to be healthy and well. In this moment, we really need to recognize the impact that these factors are having on far too many people's lives in America. And the systems that should be helping are not responding well to these challenges, as we are all experiencing. And the consequences are not working out well for folks. Not just because there's a new amount and an overwhelming amount of people who need help, but because these systems just aren't keeping up with how people live their lives.
What's the role that technology can play? Are you seeing similar shortfalls there in terms of what technology can do? There are a lot of reports that they've been the ones stepping up to the plate. I don't agree or disagree. I mean, I agree to some extent. It's certainly better than the current administration that we have now. But what are your thoughts? I
see this as a moment where technology needs to be pushed to change in a different way. And what I mean is that this is a moment to push a change to a divided approach that technology has from the work of social impact, the work of social support, where it's seeing itself as the solution, and it's not. This is a moment where technology actually has to be integrated into the work of social impact, of the social sector. And it has to be an effort where packaged technology interventions that amplify the right human forces are focusing on improving lives. So what do I mean? So have you ever known anyone, or you ever tried to kind of find help when you needed it through a public agency?
Oh yeah, sure.
And so you know that dynamic. And let me just describe it for folks and what happens typically. So you find yourself in need of something basic. You get on Google, that's if you have access to the internet. You take an hour, sometimes several hours, to find that one agency you think is going to help you. Then if you're lucky, you find the right agency and you get through the process for, say, in this moment, unemployment insurance benefits. But you don't know if you're eligible for those unemployment insurance benefits because you need to either interpret the rules yourself that are on the site that you found, or use the information on that site to call someone to tell you if you're eligible. And bear in mind, you haven't even applied for the benefit yet. Then because you're unemployed, there's a good chance that you've lost your health insurance. Not to mention, you realize that your last check isn't going to stretch far enough to feed you past the week or the next 2 weeks. So you may need some food assistance. So you need to apply for SNAP to feed yourself and your family. And so you go through the same process you just went through to find the right place to get the unemployment insurance benefits that you found. Again, to find the health coverage you can get. Again, to find the food support you can get. And again, depending on whatever else you may need in that moment. And we know from experience that good tech combined with good policy and a deeply human-centered approach can change this ineffective pattern, and make it simpler and more dignified and more streamlined than it currently is. But that process means that is technology not trying to solve the problem, but actually trying to integrate itself into the challenges and opportunities that the social sector faces.
Shoshana Zuboff points to this in her book. It's really been focused on monetization for the last several years under the guise of social good.
Right. That's exactly right.
And there's got to be a way, to your point, to integrate those things. How do you think policymakers can help? I mean, they print money at a moment's notice. That $2 trillion would have gone a long way over the decades to help people get where they needed to be.
I think we need policymakers to look at this in a short-term and long-term way to help reverse the tragic trends we've been seeing, and in particular, to reverse the inequities that we've been seeing. So right now, today, we should be using this integration of technology into tried and true policy and program approaches that we know help people get access to all the things that they need as quickly as possible, whether it be income or healthcare or food or housing or whatever it may be. And while enacting policies and appropriating money is great, it's not enough. The devil is really in the details, and we need policymakers to pay attention to people needing help enrolling in the programs that they are appropriating money to, or that they are passing policies adding flexibility to. These people who need help from these programs need support connecting to these programs, particularly when we find ourselves with these shelter-at-home orders in ways that are really simple and streamlined. And simple fixes can really make a big difference if they pay attention to how the policies are implemented, like allowing people to fill out and sign applications electronically. These are things that we can do in other sectors. Why can't we do this when people actually need help? From where they may be staying to be safe, like just simply using email and text notifications to inform folks of what may be happening or where they actually can find the help, or like using images, text images to provide proof of their eligibility for the help that they're asking for, or just simply using tools that help people just know if they just might be eligible for the help that they're looking for without spending hours searching the web and calling around just to find out that they're not. In the long term, we know that technology can help accelerate some of these good practices, these things that we're talking about immediately. If we can still expect takeout, shop for wherever we want, and have it all delivered quickly with just a few clicks in this moment, why shouldn't that be the case for public support or supporting programs meant to help us with our most essential needs? And so we need an overhaul of how public agencies provide their services using technology. In doing so, to increase our ability to achieve greater economic stability and self-sufficiency. And just to spin out more of what I'm talking about here, many of the public programs that people are experiencing right now are structured in such a way that they are fragmented, with each generally serving a relatively specific subset of needs, such as, health or food or income support. And we're seeing how this approach is failing us when we need support the most. So we have a real opportunity right now to reimagine how people get connected to health by integrating technology and the view of technology into how we think about policy and programmatic approaches that we know have been tested in that work. And we already know that if we do this, it will increase the extent to which those of us who find ourselves in moments by no fault of our own, with multiple needs, having the ability to access the full range of programs that we are both eligible for and need in a way that will provide us with the stability we need in moments of instability.
And in an apartheid situation, which I'm not afraid to say we're in, we might as well start using the term for what we're actually in. It's going to be even more difficult to pull the political levers that are going to make what you're talking about happen.
We're hoping for a sea change here. But to your point, when I look around both our political sector, the social sector, and the technology sector, I'm seeing extremes that if we could actually bridge those gaps could help us. Like one extreme I see on the technology side is these visions of an app that will be the silver bullet. Always looking for that one thing, that one model that would solve this or that big social problem, but allow them to still operate under the business model that they have, walking around lamenting, if only. And we're hearing this a ton, from tech. There's a lot of Monday morning quarterback, and if only we could implement something properly, if only we had local entrepreneurs who had access to loans, if only, if only, if only. And then on the other extreme, I see the social sector, and particularly the political sector, so resistant to the types of changes and to the types of technology that could actually help address some of these questions that they miss out on significant opportunities to really deepen their impact, particularly when it comes to inequities. And so the question does become in this moment, are they willing and ready to kind of bridge that gap? Or are they willing to stay in the balkanized kind of approaches that have got us in the problem or in this predicament that we're in right now, today?
Yeah. We've got to presume they're starting from a social good frame and not capitalism under the guise of social good.
Exactly. And that this can't be a taking activity. This has to be about helping.
Yeah. Well, maybe some of the companies, some of the sharing economy companies, for companies that are imploding right now, maybe they'll start to realize that, hey, you rely on these people and people to be healthy, and you've got a diverse staff that you're not treating right, and you've got folks on your corporate team that don't look like the people driving around for you, and now you're losing your company's losing value as we speak, exponentially. So maybe they'll have some, maybe they'll bring some subjectivity to this now. Some compassion.
Yeah, I think that's right. I hope that they realize for the workforce that they're relying on that inequity is bad business and that they have to do better in this moment.
We're going to take a quick break, and when we come back, we'll hear more about Alluma. Stay with us. So what particular programs is Alluma working on? I'd love to hear about those and how our listeners can be supportive.
Yeah, so the programs that we have are really some digitally based efforts that are about at one time collecting all the data elements that people need to apply for these programs, only collecting that information once. screening that against the range of programs that they actually have using the rules engine, giving them back what they're eligible for, and then with their choice and consent, helping them enroll in those programs. And so the goal is to let families and individuals apply for multiple health and social services and other supports from one place at one time, and allowing individuals to do this regardless of circumstance or location. We'd love to have folks kind of join us in this work. The goal really is, how do we actually make what is the complex simple, and what is kind of the multiplicity of programs actually make it just one door that folks can walk through when they need that help and get that help. Currently, we're working with a number of counties, about 40 counties in the state of California. We're working with the state of Maryland, and we're also working with the state of Arizona. Some working with all of those programs like Medicaid and SNAP and TANF, and then others working with their local coverage programs to provide healthcare or food or income assistance or housing assistance.
Lots of ideas here, lots to deal with. So hopefully folks listening will figure out ways to reach out to Robert. What are some final ideas you'd like to leave with us before we close, and where can we find you online?
At alluma.org. And please, join our effort, sign up for our newsletter, follow our blogs. And one thing I just like folks to take away, if they hear nothing else from me, that technology needs to be a necessary component of social change. This is our kind of belief of integrating technology and policy. And so it would be wrong for anyone to conclude otherwise from this moment or for what I'm saying. In fact, we need more and better technology in the public sector broadly. And while, technology is necessary, what we're finding it is wholly insufficient to the task in front of the public sector. So we need technologists to spend more time learning about the real constraints and opportunities that exist in the public sector, specifically in the social sector broadly. But by the same token, we need social innovators and policymakers to learn to embrace technology. And I'm not just talking about hardware, software, I'm talking about the approach as a tool that can not only extend their work, but as I said at the top, broaden and deepen their work too.
Yeah, if we have folks and folks working in the policy space looking to bring more technologists to the table, complaining about how there aren't enough technical people at the table influencing policy, well, I can assure you there are even fewer folks conversant in social justice issues and equity issues working in this space. But thanks to folks like Robert, the future is bright. Robert Phillips, President and CEO of Alluma, an organization that provides people-centered, policy-driven technology solutions and consulting services to state, county, and local government agencies, nonprofits, and other partners. Robert, thanks for joining me.
Thank you for having me.
And that concludes episode 129 of the podcast. Thanks so much for listening. If you like what we do, we'd love to hear from you. Please take a moment, head over to Apple Podcasts or wherever you listen to podcasts. Give it a review. It helps others know what they can expect from the show and really helps us out. Thanks again for listening, and I'll see you back here next week. Take care.